Hi everyone, I'm Hindi from Great Paws and All, and today we're going to be talking about how to help senior dogs stay comfortable, mobile, and happy longer. So I'm joined by Dr. Sarah Thornton from the Toronto Veterinary Rehabilitation Center. And Dr. Sarah is a veterinarian with a special focus on chronic pain management, mobility, rehabilitation, and integrative care. A graduate of the Ontario Veterinary College, she combines conventional veterinary medicine with therapies such as acupuncture and rehabilitation to help pets improve mobility, reduce pain, and maintain the best possible quality of life. Dr. Thornton is a certified veterinary medical acupuncturist, certified canine rehabilitation practitioner, and certified veterinary pain practitioner. Welcome, Dr. Sarah. Thank you so much for joining me.
Thank you for having me.
I'm really looking forward to to this interview. So let's just jump in. Senior dog parents have heard of rehab. Unfortunately, many have not because their
Mhm,
vets are not really mentioning it to them, at least in my experience.
mhm.
But the ones who do know, like they're not exactly sure what it is. They may have heard the terms kind of thrown around. So, what does veterinary rehabilitation actually involve?
I mean, it's a good question. I think it's most similar probably to human physiotherapy if we kind of look at it
Okay.
like at a human equivalent. Um, Most of what we're doing is trying to evaluate the patient's current level of function, current level of mobility, and see how we can improve that. And so, for senior patients, that could involve a whole bunch of different things. Um, there are certainly a lot of different aspects to rehabilitation, all the way from sort of like the pain management side, which may be for some of those dogs primarily driven by pharmaceutical intervention. And then there's kind of like all of the other things that we layer on top of that. And that's sort of how we create what we often refer to as a multimodal pain management plan for those dogs. Um, and so the pharmaceutical aspect of that might involve one or more drugs. But then the hope is that we supplement that with a bunch of non-pharmaceutical things that will help to even improve their comfort and their function more than they might be able to with just pharmaceutical drugs. So for us, I mean, at my practice, typically, if we're seeing a senior patient for a rehabilitation program, they might be getting a combination of things, and it partly depends a little bit on how functional they are to start with. They might be getting some hydrotherapy. They're often getting some exercise therapy, or sort of strength-based
Mm,
therapy. Oftentimes, we're doing some manual therapy, which could be acupressure, could be some massage, could be heat or cold therapy. They may have some acupuncture thrown in there. We do a lot of stretching in our senior dogs because nobody stretches enough on the human or
true.
the animal side.
True.
And then there's all the modalities. So there's a whole bunch of modalities like laser therapy, shockwave therapy. Um, we use a lot of kind of electrical stimulation, things like TENS and neuromuscular stimulation. So it's really a combination of a whole bunch of different facets, many of which are used in human physiotherapy, um, to try to create a plan that is most suitable for that particular patient.
So, are there, can all senior dogs benefit from this, or is it really if they have a specific condition? Like, for instance, one of my dogs became suddenly paralyzed, and there was a lot of like physio that I was able to do at home, exercises.
Mhm.
And he didn't need hydrotherapy, but it was mostly like manipulation of his, and we got him walking again. So is
Mhm.
it for a specific condition or just like anybody that has a dog that's kind of class as a senior could benefit?
Yeah, I mean, ideally, I would like to see all of my patients like in their middle age era,
Mm,
before they really develop any issues, before they're trying to recover from an injury, before they have any significant arthritis, because there's quite a bit that we can do proactively and preventatively to try to mitigate some of the things that we know are going to come down the line. I would say the larger proportion of senior patients that I see usually are coming for arthritis management.
Right.
So they've been diagnosed with arthritis. They may or may not be on pain medication already. And either their family veterinarian or even sometimes their caregiver is just looking for additional things to try to help manage their arthritis that are maybe non-medication related. Um, Certainly sometimes we're seeing them because they have sustained an injury and we're helping to recover them from that. And then, I mean, when we see them, it's not uncommon, especially if they're coming for a specific injury. It's not uncommon for us to find other things. When when they come to see me for an evaluation, we're obviously looking at the specific thing that they've been referred
Mm,
for. But I'm always doing kind of a more holistic exam and looking at
right.
their overall orthopedic health, their overall musculoskeletal or myofascial health, their overall neurologic function, just to make sure that we aren't also seeing early signs of other things, because if we do, then we incorporate all of those things, all of those issues into their treatment plan. So we're not just working on the limp or the one thing that they've been referred for. We're kind of addressing all of the things holistically that may be impairing their mobility.
Because it's never just a limp. It's
It's
always,
never just a limp.
yeah,
And especially usually by the time that they come to see me,
yeah,
if that limp has been there for a little while, they probably have developed some guarding and some muscle tension in other areas.
right.
Almost every senior dog that I see has back pain because they've sort of
Mm,
been compensating for
yeah.
whatever's been going on with them. So, we're trying to address all of those things at the same time so that they can be as comfortable as possible and return to as close to whatever their previous function was as we can.
So, in your experience, what seems to be like the common misconception that people have? Like, did they have some kind of impression about what rehab was before? And then once they speak to you, like all the things you're talking about now, is it something they were surprised by, or, they should have come earlier?
Yeah, I mean, I think the most common misconception is probably that it's too late. Um,
Oh,
and
interesting.
and so I think, sometimes they end up coming because there's been an injury or something, but maybe they have had arthritis, that they've sort of been managing relatively well for several years. And then as we're going through the discussion of all the things that we're going to try to address, I think, oftentimes it's eye-opening to people to know how comprehensive their program is going to be and how many things that we can now offer our pet patients that weren't even available probably 5 or 10 years ago, and certainly probably weren't being recommended as frequently as they are now. And so I think some people may think that if their pet has some mobility impairments or if they have arthritis that's kind of like pretty moderate to severe, it might be too late
Hmm.
to see any benefit from rehab. But our goal is always to sort of meet them where they're at. And there's never nothing that can be done. There's always something that we can do to improve their comfort or mobility.
So something that I see a lot from senior dog parents in my Facebook group is
Mhm.
that I don't want to say they dismiss an issue. I think they assume it's just natural aging. And, I always encourage them to see the vet because it's never aging. It's not a diagnosis. There's
Correct.
always something going on. So how can we help them see the difference between what's normal aging and what is actual pain? Or is there no such thing as really natural aging? Because everything has a reason and could have a treatment. Do you know what I mean?
Yeah, absolutely. I mean, there's that saying, age is just a number.
Mm,
And I mean, I certainly have some of my patients that come in and they might be 13, but they're living the life of a 5-year old.
right.
And I have the opposite as well. I have some dogs that come in and they're 5 or 6 and they look like, they're struggling more, closer to probably like a 10 or 12-year old. Um, so, so in some respects, age is just a number. There are certain things that are, somewhat predictable that will happen as we all age. And one of those things to some degree is a little bit of slowing down, just in terms of maybe their stamina. So, a dog who used to walk 2 hours a day, if they're, 12 or 13, that might just be too far for them now.
Mhm.
And it could just be an issue of stamina. It's not necessarily because they're painful or because they have an injury. Similarly, older dogs tend to sleep more, and that's considered normal. I mean, your 90-year-old grandparent probably sleeps quite a bit during the day too. So to some degree, some of those changes are expected and some of those would be considered normal. Um, for me, what it is definitely trickier to identify pain in senior dogs, and especially the progression of chronic pain, versus acute pain that you would have with an injury or something.
Mhm.
Because usually with acute pain, there's an immediate pain response. It's a
Right.
fairly obvious one. So you stub your toe, you might scream out. They tear their ACL, they're probably immediately not putting any weight on it. So, acute pain is relatively easy to recognize, even
Right.
in dogs. Um, Chronic pain is trickier because it tends to be more slowly developing, and it's slowly progressive over time. And it's true in people too. I mean, if you have arthritis, it's not that acute ouch pain.
Mhm.
It's kind of a low level, annoying, all the time pain.
That
And
you
it's
learn
not,
to live with.
that's the thing. It's not like you can't function with
Right.
it. You kind of learn to adapt to it. And so we see the same thing in our senior pets, which makes it a little bit trickier to
Mhm.
identify because they're accommodating to it gradually over time.
Right.
Um, so the thing that I usually try to have people watch for are more of the subtle signs. Um, and those tend to be more behavioral things. If somebody, and it's very common, when I see people, whenever we see somebody for an assessment, we always have them fill out a pain score. And oftentimes that can be really hard for owners of senior dogs to do because they're having a hard time already trying to identify that pain. Um, and most of the time, one of the things that they'll say to me is, they're not crying out or they're not,
Yes.
they're not vocalizing.
Yes.
And I always try to make people aware that, if your dog is vocalizing, they're like
Yeah.
over here with their
Yeah.
pain, unless they've just had an acute injury. But if they've had a kind of like chronic, slow progressing
Mhm.
pain and they're starting to vocalize, they probably need to be evaluated kind of urgently and make
Mhm.
sure that pain is addressed. Most of the time, they're not quite there yet. And so we're typically looking for more subtle signs, and typically those are more behavioral changes. So if the dog used to do something pretty regularly and now they're sort of just not that interested in doing it, or they hesitate to do it, or they're not capable of doing it,
Mhm.
that to me is a bit of a red flag that something has changed. Could be weakness, it's not always pain, but they definitely should probably be evaluated for pain at that point.
So when, I guess we really covered this, but when should someone consider rehab for their senior dog? And is it something they can just decide on their own? This, I'm kind of throwing this in. Or do they have to go through their own vets? And then you have
Yeah,
to work closely with the vet? How does the actual process work?
yeah, that's a good question. Um, I think it probably depends where you live and what the regulations are in your specific area, because it's a little bit different everywhere. Um, I mean, usually if somebody is recognizing some of these early signs of pain in their dog, and the most common ones that I would say that I have people watch out for are um, hesitancy or difficulty with stairs, where they
Mhm.
used to sort of do the stairs pretty easily, and now they're either kind of like trying to decide if they want to do it or not, or it looks like they're struggling a little bit, either going up or going down. Um, Dogs who used to be able to get up on furniture
Yeah.
pretty easily, if they were allowed, or in and out of the car pretty easily, and are now kind of sizing it up a little bit. They're not sure if
Mhm.
they're going to make the jump or not, or they're just waiting to be picked up or asking to be picked up. That's a behavioral change that I would say probably warrants some additional attention. And then the other one that's pretty common is transition. So the way that they go into a down and the
Hmm.
ease with which they can get out of a down or from a down into a sit. That's usually one of the areas, especially dogs who are arthritic, will sort of look a little bit labored doing that, either on the down or back on the up. Or when they do get up, they have a little bit of a hitch in their step
Hmm.
until they kind of like walk it off. So those are all sort of the more subtle things that I have people look for. If caretakers are seeing that, um, then they have a couple of options. They can either, I mean, it's always good to see your family vet first, obviously, to get kind
Of
of
course.
an overall once over, make sure that there isn't something else that they're picking up on. And they often are sort of the first point of contact for, if they think that there's some pain there, possibly doing a pain trial or starting them on some medication just to see sort of what the response is to that. Um, Depending on where you live, if you have a rehab center in your area and they have a vet who is rehab certified on staff, you could theoretically go to them first. So in my practice, we sort of have a multidisciplinary practice where, most of the senior dogs would come to see me first. I would sort of do their pain assessment, do their full, rehab assessment. If we need to start any medication that and they aren't already on some, then we would get that going and then kind of put them into their rehab plan that's mostly driven by the rehab technicians. There are some other practices where, if it's mostly run by rehab technicians and they don't have a vet on staff, in that case, at least in Ontario, they would require a referral from their veterinarian. So in my case, because I am a veterinarian, I don't necessarily need a referral to see that patient. We always ask for one just so that the family that knows that they're going to be seeing us for rehab.
Right.
But certainly if you're seeing a practitioner who's not a veterinarian, then they need to be referred by their primary veterinarian.
So if we could talk about specific therapies, just so people
Mhm.
have a better understanding of what they actually entail. So what is hydrotherapy and how exactly does it help? Is it the same as them taking them swimming, or do you need an expert or a technician to actually show you how to do it?
Yeah. Um, so if we're using it for therapy, then it's not exactly the same as swimming, although swimming can be considered therapy as long as it doesn't make the dog sore. When we talk about hydrotherapy in the context of rehabilitation, we're usually talking about one of two things. Either swimming, but in sort of like a controlled way in a pool, usually with a therapist, or an underwater treadmill
Mm.
where they are in a tank that is filled with water with a belt that acts as a normal treadmill would, and they are walking on the belt with the buoyancy of the water acting kind of as support for them. Um, so both can be beneficial. In some cases, we might have a preference for one or for the other. Sometimes it's just a question of what you have available to you too. Um, so swimming with your dog on your own could be part of a therapy program, but it wouldn't be necessarily a replacement for one of those two things. It could be supplemental as long as it's sort of under the direction of the therapist.
Because I know actually in my group, a member was just asking this question the other day because she doesn't have any access to hydrotherapy. So, but she wanted to, but sometimes
Mhm.
it's like people live in the country, it's hours away. So could swimming, but like you said, it's obviously not therapy, but could they actually make it worse if they just take them swimming because
It
they don't
depends
have,
on the condition. It depends on the
right,
condition for sure. And that's why I say, I mean, for most healthy dogs, if swimming can be a great exercise for them. It's great for their cardiovascular health primarily. And it can be a great activity for their muscular health,
right.
especially in the front end, because swimming for dogs is almost entirely driven
Mm.
by their front legs. Back legs don't provide a lot of power. So almost all the power comes from their front legs. So I will sometimes use it as a supplemental therapy that people can kind of do when they're not seeing us for rehab or sort of in between their rehab sessions. If we're trying to work on front limb strengthening. The caveat to that is in dogs who have injuries or issues in the front leg joints. So, for
Mhm.
example, if they have elbow disease or if they have shoulder disease, sometimes that motion will make it less comfortable. Sometimes it will
Right.
make it more comfortable. And it kind of just depends on the dog. So, you have to know the patient and you have to know what condition you're treating. And sometimes it's trial and error, to be honest. Um, but it could go either way with
Right.
swimming. I think one of the common misconceptions about rehab in general, and I think this even applies to the vet community still, is that it's it's mostly hydrotherapy.
I would say so from
Yeah,
what I
and
see. Yeah.
I think a lot of people, and sometimes we have even on the referral, it'll say being referred for hydrotherapy, and there's a good proportion of our patients that will receive hydrotherapy if they come to see us, but there are certain conditions where I would not put them in the tank, or not have them swim. And we, I mean, at least in my practice, we find the land exercise component, so the strengthening, the flexibility stuff, to be equally, if not more important in some cases than hydrotherapy. There are definitely some things where, we would be limited in what we could achieve without the water therapy, but it's not the be all and end all of rehab. And it kind of depends on what you're treating in terms of whether it's going to be beneficial or not.
So acupuncture seems to be, again, just like in my experience with senior dog parents, it seems to be the most well-known or the easiest thing that people are willing to try,
Mm-hmm,
just from what I see. And I know one of my dogs, I used to take her for acupuncture. We were living away for a few months, and I finally saw a holistic vet, and part of his treatment plan was always acupuncture.
mm-hmm.
And it wasn't because they had pain or arthritis, whatever. It was just part of his like overall well-being plan.
Yep.
And she went like twice a week for about 3 months. And she did not have arthritis, well, that I know of. I mean, she was fine, but it was just like overall. And I remember when we moved and I couldn't find someone else, I saw such a difference in her, I don't even know how to, just like her overall well-being. She seemed to have, I can't even think of the word. She didn't get worse because she wasn't bad. I think she lacked vitality,
Okay.
which I didn't know she lacked it before. But after
Mm-hmm,
3 months of acupuncture, it was amazing. It like perked her up. And I noticed a difference when she didn't have it. So when it comes to acupuncture, is it really only for arthritis and pain? Because you do acupuncture as well. So is that
mm-hmm.
something else that you think would be helpful for dogs for so many conditions?
Yeah, I mean, it certainly can be, and I think it's probably something that is a little bit better known, to a lot of pet caregivers, because it's pretty well accepted
Yeah,
now in
for
human
healing.
medicine.
Yeah.
And of all the things that we tend to use in rehabilitation, acupuncture actually probably has the most evidence to support it. Not necessarily as much in pets as we would like to have, but there's so many human studies now for acupuncture that
Mhm.
it's kind of hard to not be on board with the fact that it can have therapeutic benefits. And I think with acupuncture, there's really kind of two different ways that we approach it, and it really kind of just depends on what your training was, I think, in terms of
Mhm.
which direction you go in. So I mean, many people in both human medicine and for pets, were trained sort of with more of an Eastern philosophy, or more, under the umbrella of Chinese medicine.
Mhm.
And so it's just a different approach in philosophy, but all of the points that we use are essentially the same. I tend to practice more from a Western perspective, and I was trained more with medical acupuncture, which
Mhm.
is more kind of just, it's sort of more anatomic, and you're sort of treating the areas of concern
Right.
rather than kind of treating a little bit more holistically and a little bit
Like
more
my dog.
broadly.
Yeah.
Yeah,
Yeah.
with Chinese medicine. So that, with Chinese medicine, it tends to be used more for wellness. Sometimes they're doing more specific conditions, or like internal medicine. Sometimes, dogs with kidney disease, dogs with GI issues, they can certainly benefit from acupuncture. Um, and they tend to probably see more Eastern kind of philosophy practitioners.
Right.
In my practice, because we focus exclusively on rehab, I am mostly treating them from the perspective of their mobility, because those are the cases that we're seeing. But that's
Right.
not to say that it couldn't be used to treat other kind of more chronic conditions that we see in senior pets.
That's not your thing. So supplements are something else that senior dog parents are interested in, but there are so many. And
Yeah.
I know in a lot of cases it's okay to give them the human version. And then how
Mm-hmm.
do you calculate the dosages? Or should I buy the vet version? And which one is good and which one isn't? And, all the chews, like the calming chews and the ones that have whatever for arthritis and CBD. And like, how do you even know where to start? Because they're
It's
over medicated in so many cases
Yeah, I mean, the world of supplements is confusing.
and unregulated.
It's I mean, in Canada, there are regulations that need to be
Okay.
passed. The bar is quite a bit lower, though, in terms of, what sort of things they need to submit to get
Mm,
supplements into the market than it would be for something like a pharmaceutical product. So it's confusing for pet parents. It's equally as confusing for us, because there are things coming out all the time, and it's really hard to keep up with all of the new things that are coming out. The problem that I find with supplements is that there's a lot out there with a lot of claims that are
mhm.
unsubstantiated, and there's a lot of marketing behind supplements without a lot of evidence to support it. So, I mean, in human medicine, it's a multi-billion-dollar
Yeah.
industry, and most of that money is spent on marketing. So you
Hmm.
have to be, there's a lot of, I caution people with a lot of buyer beware when it comes to supplements, because there have been studies that have shown that sometimes, what it says on the bottle is not even what
Yeah.
is in the bottle.
Right.
And that's, we see that happening quite a bit with CBD, especially CBD that is specifically pet products. So in
Hmm.
Canada, there's no legal avenue for CBD to be marketed to pets at all.
Okay.
Um, so everything that's out there is not, if it says CBD, sometimes it's a hemp supplement, and they're claiming that there's CBD in it.
Right.
Most likely, it's just hemp, and hemp on its own doesn't have CBD in it. So there's a lot of marketing that goes into it. Um, when it comes to things that I think are worthwhile for senior patients, I think it depends. The way that I look at it is, what is the age of the dog, and what is the status of their disease? Um, I would much rather see someone, because these things are not cheap. Um, I would much rather see someone spend money on something that we know is going to work than spend money on something that we think maybe could work, but we really don't have any evidence to support it. Now, that being said, there are some supplements that we do have some evidence for. And so those are the ones that I tend to recommend. So, in terms of joint supplements specifically, there was a study that came out a few years ago that was pretty well done, and it looked at some of the more common things that we tend to think about when we're thinking about joint health. The one that has overwhelmingly more evidence to support it are omega-3 fatty acids, so fish oil. Um, Most of the time, if people are using a fish oil product, they tend to be underdosing it. And most of the recommendations, recommendations on the bottle may be too low, because they're geared more towards dermatologic conditions, or maybe some other conditions that are not inflammatory. But
Oh,
for
right.
inflammatory conditions, we usually have to go higher with the dosage, and we usually have to calculate a dose. So I think if I was only going to pick one supplement for my senior patients that would benefit their joint health, but probably would also, I mean, omega-3s have been shown to have beneficial properties for brain health,
Hmm.
cardiovascular health. I mean, they're sort of like an all encompassing good supplement. That would be the one that I would be choosing. Things like, that we think more traditionally for joint health, like glucosamine, chondroitin, MSM.
Right.
I mean, those are the backbone of most of the joint supplements that are out there. The evidence to support those, especially in dogs, is kind of weak. So it's not
Really?
to say that they won't help, they could be helping, but the clinical evidence to support them is not as good as with omega-3 fatty
Oh,
acids.
interesting. I'm
Yeah.
surprised.
So that doesn't mean they're not helping. It doesn't mean that you can't give them. Um, to what degree they're going to help depends how far along the dog is with their arthritis. Because the goal with giving supplements is there's nothing in there that's relieving pain. So I don't actually
Hmm.
even expect them to look significantly better when they're on their supplements. The goal is to give them as many cartilage and joint friendly molecules as we can to keep everything in there as happy as possible and hopefully slow down the progression of their disease as they age. And so we may or may not see a clinical improvement in them, but that doesn't mean that they are not doing what they're supposed to do because they're kind of working in the background and it's more of a long term strategy.
Can I ask you quickly about turmeric golden paste? Because
Mm-hmm,
there's a very popular Facebook group and it's for dogs, humans, and horses.
mm-hmm.
And of course, you have people that have seen amazing benefits with it for their dogs and others because, it works for you, but it doesn't work for the next one. So, how do you feel about that in terms of like your omega-3s? It would never replace them. Could it work together, or you don't see much evidence for turmeric?
It certainly could work with it. I wouldn't replace my omegas. That's definitely
Mm,
still going to be my first recommendation. Um, there are a whole bunch of other things that have varying levels of evidence to support them. So some that we see commonly in dogs, green lip muscle has some decent evidence to
that's
support it.
right. Yes.
Undenatured collagen is one that I like that has some pretty good evidence to support it. Um, there are a lot of studies in humans that I think we extrapolate into dogs. And so like most
Mm,
of the things that we are using in dogs have very few, if any, studies in dogs to support their evidence. But there may be studies in humans, and so we have just kind of
right.
anecdotally or
Okay.
empirically extrapolated that. So again, it's not to say that it couldn't be beneficial. The problem with most of those, things like herbs or some of these other molecules is they have been shown in scientific studies to have anti-inflammatory
Hmm.
benefits in a lab setting, but have not always been demonstrated to have clinical benefits in either people or dogs. So just because they have anti-inflammatory benefits in a lab, because they may change the inflammatory markers, doesn't mean they're going to do that same thing when you put them into a
Right.
person or into a dog. And so that's an important distinction to make. And the other issue is we don't always know at what dose or at what frequency we should be using those things. So turmeric has been shown to have anti-inflammatory properties. Do we really know how much turmeric we should be giving a dog? Do we really know in what form? Do we really know how frequently? I don't think we have that data yet. So again, it's not to say that it can't be beneficial. Um, I just think that if some of these things are being marketed in a certain way with specific claims, if they don't have the studies to back up those claims, then you should be a little bit weary of them.
Okay.
The
Thank
other
you.
thing that we need to
Oh,
just
yeah.
be mindful of too is, some of these things can potentially, even though we consider them to be benign because they're herbs or they're natural, um, some of these things can definitely interact with other medications. So you don't ever want to start your dog on a supplement without talking to your veterinarian, especially if they are on other medications, because sometimes there can be some interactions.
Absolutely. So we can move on to massage therapy. So
Mm-hmm.
how is massage therapy, how can it help dogs feel more comfortable? But also it seems like it would be something easier for senior dog parents to do because they can do it any time of the day. They don't have to bring their dog to a facility if it's too
Hmm.
hard to travel or it gets too expensive or whatever. So
Yep,
obviously they would need to be shown how to do it properly, but how helpful is that? And I'm sure it depends on the condition, but can it play a big role in helping our dogs feel more comfortable?
100%. When I see senior patients, the three things, I guess, that I will have people doing at home almost right away, because it's easy for us to teach them to do.
Mhm.
It's inexpensive, and as long as the dog is okay to be handled by their own caretaker, it's going to go much better at home usually than it would go in the facility anyway. Heat therapy, massage at home, and stretching. Those three things together, if we kind of think about it for ourselves, if we did those three things on a daily basis, every single day, 5 minutes every single day, most of us would have much better mobility and much less chronic pain. We are probably more likely to do it for our dogs than we're probably like going to do it for ourselves.
Yeah.
Um, and it doesn't usually take more than five. Well, I mean, the heat, I usually have them kind of keep that on for 10 to 15 minutes, but doing a little bit of massage and a little bit of stretching, you can do pretty quickly. For senior dogs, especially, I find they're very accepting of heat. It feels
Yeah.
good. They usually are pretty chill towards the end of the day. So if you have a predictable time where you know you're going to be snuggling up with your dog at the end of the day and they're going to lay there calmly, that's a great time to throw the heat pack on, 10 to 15 minutes or whatever they'll tolerate. And then, yeah, a little bit of massage just to sort of help release some of that muscle tension. So the heat does a little bit of that for you or gets them ready for that. And then the massage can help kind of just accelerate that a little bit more. And then finish off with a little bit of stretching in some of the more specific areas where we know that dogs are going to hold tension as they age and as they become
Hmm.
more senior. If people do that on a regular basis, it's pretty amazing how well they can maintain them in between the times that we're seeing them. And oftentimes, that's what I have them start doing right away. And sometimes, if they're doing great and we're actually going to graduate them for a period of time from rehab, that's one of the things that we're going to have them continue to do on a regular basis.
So do you think people can do that instead of doing anything else? I mean, we're going to get to cost afterwards, but
Mm-hmm.
would that be effective enough or you're going or it's obviously going to depend on what their condition is that you're trying to treat.
Yeah, I mean, it will depend for sure. It's always going to be a part of the program, I would say, at least
Mm,
when we
yeah,
see them. And it's often the thing that we have them doing at home. It's always going to be better than nothing. So
right.
if they can't get to a facility or if they can't afford to be in formal rehab, um, there's always stuff that we will teach people to do at home instead of coming to see us, and that's probably high on the list of things. So, depending on where they are in the progression of their disease or what we're trying to treat, it might not be enough, but it's definitely supportive of the program, and sometimes it is all that they're doing at home, and it's still going to help to some degree.
So is there such a thing as chiropractic care as part of rehab? Like a human chiropractor?
Yeah,
That type
yeah,
of
there is.
manipulation or
So there is a certification program for animal chiropractic. It can be taken either by a veterinarian or by a human chiropractor who can then be certified to do animal
oh,
chiropractic. So it should be done by one of those two people only, either a veterinarian who's gone through the training program or a chiropractor who's gone through the additional training to be an animal chiropractor. Um, there and again, I think this is going to be somewhat dependent on where you live. There are definitely changes that are happening currently to the Veterinarians Act in Canada, where there's some discussion about having all of the things that would sort of fall under the umbrella of rehab and associated
mm,
practices. They may all have to be under the supervision of a veterinarian. So right now there are human chiropractors who have their own practices that sometimes we'll see with animal
oh,
patients in their
really?
practices.
Wow.
They don't always require a referral right now from a veterinarian. So I think there's a gap there for sure. I think even if they're not under the direct supervision of a veterinarian, I do think that they should at least require a referral from a veterinarian because they need to understand what the medical history is for that patient.
So you don't
Um,
do that. Like you
so
don't.
I don't do it myself, but I do have an animal chiropractor who works in our practice under me.
Oh, so
So she's a human chiropractor who's done the additional
oh wow.
certification. And so as far as chiropractic goes for senior dogs, it is high on my list of things that I would have people doing if they could afford it. I wouldn't necessarily put it ahead of rehab, but we will all often do it in
Mm,
tandem. Um, and we have a lot of caretakers who are sort of, doing both. And the reason that I think it's so beneficial is because most of these dogs, as they age and as they start to either develop weakness just by way of aging, which is predominantly going to happen in the back end before the
right.
front end, unless they have any underlying medical or orthopedic conditions in the front. Um, to compensate for that, they tend to shift their weight forward and they tend to sort of like use their back muscles and their hip flexors to kind of pull everything forward to take some of the weight off of their back end. And so in doing that, they get really tight backs and sort of develop kind of a pretty characteristic low back pain that's probably not that unlike what we see in people as they age. And they tend to get tight hips, tight hip flexors. Um, and so I think, and in addition to that, also have tight sort of spines and maybe some spinal arthritis that's associated with that. So I think chiropractic care can go a long way in just helping to unwind some of the compensatory changes that we see in dogs as they age, just because they're shifting their body weight around to try
Mhm.
and make things a little bit easier and a little bit more comfortable. I think you have to do your homework and make sure that you're comfortable with the person that you're seeing. I don't like to see a lot of really aggressive, we think about
Mm,
chiropractic in people that's like, aggressive, that
yeah,
cracking and popping. And
yeah.
I don't like to see a lot of that in in our pet patients, especially the older guys, because I think it's just too much for them.
Sure.
Not to say that it's necessarily unsafe, but I think it's too much manipulation for them. So a lot of chiropractors will do sort of gentle mobilizations. Our chiropractor is very gentle with our senior patients, and it's just to sort of like unstick things a little bit.
Mm,
Things get sticky as you get older, just to give them a little bit more spinal flexibility. And our chiropractor in particular does at least as much soft tissue work on our patients as she does sort of like spinal mobilization or manipulation. So she's really just trying to unwind a lot of the areas that have gotten tight over time as they've gotten older to just provide another level of kind of pain management, improve their mobility, and just allow them to move a little bit more freely. So I think it can be really, really valuable for senior patients, but I think there needs to be a little bit, and this is happening already, there needs to be a little bit more guidance in terms of regulations around it.
mm.
And you just have to make sure that you're comfortable with the person that you're seeing.
So if we move on to quality of life, you've obviously seen so many patients that have been able to start doing activities that they weren't able to do for a long time before rehab.
Mhm.
Um, so what improved, and I guess this depends again on what the issue was with the dog, but like what improvements do you think that dog parents would typically notice first? I guess like generally speaking.
Yeah,
And
I mean,
are they obvious changes?
in some cases they can be, but they aren't always dramatic changes. And I usually set that expectation with people from the beginning. If we're working on, for example, if we're working on hind limb strengthening and core strength, which is a pretty common thing that we will work on with senior patients, I usually tell people, they're losing muscle mass as they age, like we all do. And so they probably already, developed a little bit of muscle atrophy in their back end. My expectation for them is not that we're going to put on a ton of muscle, a ton of visible muscle on them. What we're really trying to do for them is maintain where they're at and prevent further muscle loss, or at least slow it down. But what we also try to do is make sure that we're seeing functional improvements. So they might not be putting a ton of muscle mass on, but we can make that muscle a little bit more functional and make their movements a little bit more functional. So some of the things that I tell people to be looking out for in terms of, positively changes that would indicate we're going in a positive direction, I guess, would be the getting up and getting down. I want to
Mm,
see them doing that a little bit more easily and a little bit more fluidly. Um, we will also usually have them make some environmental modifications that will also help with that, though. So it may not strictly be because we're doing strength training,
right.
but just giving them a little bit more traction at home.
Yeah.
Sometimes we'll put toe treads on them to give
Hmm.
them a little bit more grip so they're not kind of paddling when they're trying to get
Yoga
up.
mats and all
Yoga
that.
mats, all of
Yeah.
that stuff. Um, but I want to see them get up and get down a little bit more easily. I want to see them if they weren't getting up on furniture anymore. Again, maybe we've made some environmental modifications to help them do that a little bit more easily, but we're looking for things for kind of them to reinitiate some of the behaviors that maybe they
Hmm.
weren't doing or weren't doing as frequently before. In some cases, if we see them, further into their progression, they may already be past the point where they're not doing stairs. So it might not be realistic for them to be going up and down the stairs
Sure.
independently anymore. And in some cases, I would recommend that they don't because it becomes a bit of a safety concern for them.
Hmm.
But of the things that they're still capable of doing, I want them to be able to do them with a little bit more ease. And the other thing I tell people to look for, which is also a little bit more subtle, is just a change in their general demeanor or behavior. So I want them to look a little bit brighter, a little bit more excited to do some of these things.
Hmm.
Um, they might reinitiate play if they hadn't been doing a lot of play. Maybe they're playing with the other dog a little bit more. So it's really more kind of subtle behavioral changes, and some functional things at home that we're looking for.
So I would imagine if they took video, like if they feel like, oh, I don't see any changes, but they sent you a video, you could point out, no, but look at this, because it might be
Yeah,
too subtle for, just a pet parent to notice, but of course you would.
yeah, absolutely. Oftentimes we're recommending that they're doing some sort of record keeping at home
Hmm.
anyway, especially if we're talking about quality of life specifically. I'm usually having them kind of keep track of, even just like with x's and o's or check marks and x's, like what are the
Right.
good days, what are the bad days, because we want to know what's the proportion of good days to bad days when we're talking about quality of life. So maybe they start having more check marks than they had x's before. um, but so again, I mean, the changes can be subtle, but we definitely want to see some sort of um, either behavioral or functional change in them after they start their rehab program.
Okay, so let's talk about money
Yep,
because I mean, we've always been swamped with bills, right? We're seeing the vet more often. There's more health conditions. Everything is so expensive. You know how it is.
yep.
So, how, I can't say like, how do they know if rehab is worth pursuing? Because of course it is. Is there a way to make it more affordable? Can they do, we talked briefly about this before, but are there, can they get like initial appointment and say, okay, I can see you only every few months or whatever, but all these things you can do in between that I can teach you? Like, how can we get senior dog parents to see that it is worth it? Like spend the money in the right place, perhaps. Maybe they're spending it in the wrong places.
Hmm.
And how could we encourage them to at least try an appointment so that they can learn how to do things at home that will make a big difference, that won't cost a lot of money?
Yep. Um, it's definitely a good question. I mean, nothing is getting cheaper in life.
Not in
Um,
Toronto for sure.
yeah, and to be honest, rehab is also not inexpensive.
Yeah,
We spend a lot of time with people, and so unfortunately, we have to charge for that
of
time.
course.
And but like I said at the beginning, we are always very cognizant of that and happy to meet both the pet but also the caregiver where they are and with what their needs are. So we will never say to somebody, if you can't afford it, we can't work with you.
Mm.
If they come to see us for an initial assessment and we know that cost is going to be a concern from the beginning, we will come up with a plan that works for them. And there's no it, doing something is always better than doing nothing. And
Mhm.
there will always be some level of benefit to it. So if they can only see us for a few sessions and we want to spread that out over time, perfect. Then we'll come up with a plan that will work for them. In some cases, if we know that and sometimes it's geographical. I mean, we're
Yeah.
in the beaches, not everyone can get there, and we see people from outside of Toronto too. It's just not practical for them to come and see us
Mhm.
twice a
Right.
week or even once a week. So sometimes we go straight to a home program because we just know that it's not going to be practical or financially feasible to see us in person. And so, there are always a lot of options in terms of what people can do in with respect to their rehab plan. We'll always tell people what we think the gold standard recommendation would be, like, to get the optimum results with
Sure.
this program, this is what we think, but here are some of the ways that we can modify that, to work within your schedule, your budget, your whatever the case may
Mhm.
be. um, the one thing that I will say is starting to work in our favor a little bit more now is, and this is something that you can't really go back and change, but for pet owners that do have insurance and have had insurance for their pets throughout their life, more and more insurance companies are starting to cover rehab, where they were not
Okay.
doing that even 2 or 3 years ago. It
Oh,
was
really?
some of the things were covered. It was usually kind of hidden in there where they had to have, had a rider for kind of what they were sort of still considering alternative medicine at the time, that they would have had to sign up for at the time when they
Right.
started with their insurance. But more and more, it's sort of being incorporated into their general policies. So for people who have insurance, it's always worth checking with their insurance company to see whether some of these things would be covered. Sometimes they will cover some of the things, but not even all of the things. So they'll often cover, they will almost always cover medications. Sometimes they will cover some of the therapies that we do. So it's worth knowing what your policy covers if you do have insurance, because it might not cover everything that we do, but we can, maybe work with it a little bit
Right.
to try and to make it a little bit more financially feasible.
It's very encouraging that there are things that people can do at home, even if
Mm-hmm.
they can't get to you as often as is ideal.
Yep.
So I think that's very good that people should learn. Are there exercises or activities that senior dog parents should not let their dogs be doing? I imagine going flying off the couch onto the slippery floor, like my dog used to love to do,
Yes.
when he was younger, is not a good idea. But what else? Some are still taking them on very, very long walks, or like the weekend warriors instead of, you know what, just do like 20 minutes 5 times a day or whatever. But
So I mean, for me, I want those dogs walking or being active as much as they can without crossing their threshold of tolerance for activity. Um, because what's going to keep them moving is continuing to move. So we want them to continue to be active. So even if I have a 13-year-old dog who's walking 2 hours a day
mhm,
and is pretty unaffected by that, then I go for it. What they need to be watching for are the subtle signs that that dog is fatiguing or starting to become painful. So if that dog used to be able to walk for 2 hours and they were right beside you or a little bit in front of you, but now they're kind of like
mm,
an hour in, starting to hang back a little
right.
bit, their threshold is probably lower than what they're still doing. And so we want to cut them off when we start to see those signs. Um, so I only put restrictions on them if it seems like the things that they're doing are making them worse. So if, they go to the dog park
Okay.
and they limp after, dog park is probably out for me. The one activity that I would say I probably discourage everyone from doing across the board is fetch. Um,
Okay.
and the reason for that is because, most of the time they have a lower tolerance for it as they get older. And because it's a repetitive use exercise, we just tend to see it's a lot harder on their joints. Any high intensity, high impact activity is going to be harder on joints, especially
Mhm.
joints that are already arthritic. So they're going to feel it more in their joints. But it's the quick start. They slam the brakes on really
Right,
hard to grab whatever it is that's in the air, and they do a real quick turn to come back.
right.
And so, in a senior dog, if you're sort of rolling the ball and they toddle over and get it and bring it back, and that's more of a mental enrichment exercise for them, that's okay. But the dogs that are still gunning it 10 or 15 times, it's they're at a much higher risk for tearing their ACL or having other overuse injuries like tendinopathies in doing those activities on a regular basis. So, if we really want to minimize the risk of them having injuries as they get older, that's probably the one that I would take out. And then I just try to replace it with something that's a little bit lower impact, lower intensity, but probably equally as mentally engaging. So for a lot of older dogs who need that kind of like
Hmm.
mental engagement. I love hiking for those dogs, either off leash or long leash hiking, because it's a lot of different kind of variations of gradients. They have to step over things, so
Oh,
it's good for
really?
their
That's
spatial awareness.
interesting. Okay.
So anything that they can be doing to continue to be active that's not pushing them past their threshold for comfort is okay in my books. And sometimes that involves swimming even, but it depends on the dog.
Okay. So unfortunately, there are a lot of very chubby dogs out there. And we
Oh,
always try and listen, it's going to make their joints worse. It makes arthritis more painful. So we know it's very important. So I don't have to ask you how important it is, but how do we convince them that it's really important?
I am pretty blunt with people
Oh,
when it
good.
comes
Okay.
to the weight. I know it can be a touchy subject for a lot of people.
Yeah.
As part of their assessment, they're going to get a body condition score. Usually, I do it out of 9, so 5 would be considered average. I Even though everybody, all of their other health practitioners are going to be happy with 5, if I can get them to 4 or 4.5, I'm going to be happy because I know
Mhm.
that every pound that they don't need needs to come off, especially if they have underlying orthopedic disease or neurologic disease for that matter. Um, so it's if I see a dog who's overweight, I mean there have been times where I have said we're not even going to pursue any other therapy until this dog loses weight
Oh, wow.
because it's the most important thing.
Right.
The most important thing that we could do for them is get the weight off. Even if I did nothing else for that dog in terms of I could inject his joints, we could do shockwave, we could do 16 weeks of rehab, none of those things are going to be as beneficial in the long term as getting the weight off.
Wow.
So I would rather have them spend their money on a prescription weight loss diet and have us closely monitor their weight over that 8 or 16 weeks and then start rehab, probably for a shorter duration of time because they're already going to feel better for having
Mhm.
lost the weight, then try to manage them through their discomfort while they're still carrying the weight. It's kind of like swimming with an anchor attached to you. Like you can do it, but you're just fighting against yourself the whole time.
Great.
So
Okay.
I would put it at the top of the list, and I'm pretty honest with people about that.
Oh, that's good because I'm horrified. Like they come out of their vets and saying anything, but never
Yeah,
mind. That's enough.
yeah. I mean, I don't think it's addressed as I don't say aggressively, but as directly as I think it should be in a lot
Yeah.
of cases. And I just even for us, I mean, some of these dogs, we get the weight off of them, and then I'm taking, my goal for most of these senior dogs is to get them off their medication. That's something we always talk about at the first appointment. If they're on pain
Mm.
medication when I see them, the goal for me is always to get them, if not off of it, at least down to an as needed basis, which is not
Wow.
possible in every case, but in a lot of cases, we can get them down to just as needed use. Um, and that's never going to happen if they're overweight. So I think it needs to start with the weight loss.
And the money they can save on all the drugs their dogs are on, they can put towards rehab.
Yep. Or put it towards the diet. I mean, I would much rather spend their money on whatever it's going to take for that dog to lose weight, even if that means they don't see us for rehab, because it, it's going to make their overall health better in the long run
Absolutely.
if they lose the weight.
Absolutely. Okay, just have a couple more questions. So obviously there's a lot of success stories that you have with rehab. Can you share one um that you really want senior dog parents to see and hear about?
That's a tough one. I think I think we have so many. I think most people that see us are surprised how much their dog goes back to acting like a younger dog
Yeah.
just because they can move a little bit more freely. I mean, even yesterday I had, I think he's 13, 13-year old. It's probably a lab shepherd mix. He's got pretty significant arthritis in multiple joints. When we saw him the first time, which was probably 8 weeks ago, um, he was really struggling to walk, but definitely was having trouble getting up on his own. He was on a pretty good pain management plan already, so I tweaked that a little bit, but not a lot. And we just worked a lot on mobility, flexibility, some stuff with modalities, and just got him kind of doing a little bit more and having them do some stuff at home with him. And when I saw him for his recheck yesterday, the one comment that his caretaker had for me was that he had not initiated play with them, or like they couldn't even remember the last time. He's 13. And he, like, over the last month, had gone and gotten his toys and was bringing toys to
Oh
them and
my
wanted
gosh.
them to
Wow,
to
that's
kind of like just
amazing.
loosely toss them for him, but he was demonstrating that sort of like that interest in play again. And at the end of the day, that's, to me, he's not walking significantly farther. He's maybe walking a little bit more easily, but we haven't dramatically increased his walks because he's pretty arthritic, and that was sort of what I had said to them from the beginning. So, we've improved the ease with which he moves around. Um, but the biggest reward for us when we see these patients is just having them have a little bit of that spark come back.
Quality of life.
Yeah.
That's amazing. Last question. So
Mm-hmm.
if there's one thing you want every senior dog parent to know about rehab, I mean everything we talked about obviously, but like one thing that might shift the balance, what would it be? I think from my own experience, I feel like it starts with vets because you don't know what you don't know. And, obviously we rely on our vets so much to help us, but if they don't suggest it, we may not know it exists, which is actually
Mm-hmm.
why I started my Facebook group, because your vets know so much, of course, but you can get so much support out there. So if they're not part of a group and nobody else mentions rehab and the vets don't talk about it, which I hope will change, um, what could we let people know that might really at least get them thinking about it?
I think, I mean, as you said, I think it's becoming a little bit more mainstream, but we're maybe not quite there yet. I mean, this is probably one of the most rapidly growing fields in vet medicine right now, which is
Okay.
great because I think that the accessibility is going to become a lot higher over the next several years, which will be helpful for people. That there will be more awareness because there will be more people that are offering it, and people who don't have access to it right now are probably going to be more likely to have access to it in the future. I think the reason that it has grown so rapidly has actually been driven by pet owners who were looking for a higher level of care for their pets than what was being offered by their vets. And I
Right.
hate to say that, but I think that's true.
It's true.
Um, and they knew that these things were available for them as people, and were starting to ask the question, like, why can't my dog get massage or acupuncture, all of these things. And by having so many pet parents ask about it, it has sort of forced
Hmm.
the industry to educate themselves a little bit more in terms of
Interesting.
what is possible. And there are very few things that we're doing in people now that, as far as rehab goes, um, that we're not offering for pets. So, I mean, right now, joint injections are sort of the new thing that we're doing for a lot of our pets who have arthritis, which is kind of the standard of care for people, and has also been the standard of care for horses for a long time, but just not something that we were doing in small animals. And now we're offering that pretty regularly for pets that have arthritis or that have other injuries, rather than treating their whole body with an anti-inflammatory. We can be a lot more targeted in the way that we treat the areas that are sore, and we only treat the joints now that need to be treated. Um, so I think the thing that I would want people to know is that every day the field is evolving, and there is always something more that can be offered, probably, than maybe what's being offered just through your family veterinarian. And it's never too late to start. So even in dogs who we think have, sort of end stage arthritis, there's always something that we can offer. And even if it's palliative pain management at that point, there's still more that we can do to make them comfortable. And we talk a lot about ways to make senior dogs still have the same quality of life and still the same level of mental engagement, even if they can't physically do the things that they used to be able to
Right.
do. Um, so there's always a component in there of kind of like managing their quality of life, even though we're not experts in palliative care. We're sort of the bridge between their kind of middle to senior years and where they end up going with sort of closer to end of life care. And there's so much that we can do in that senior to geriatric period, from a pain management perspective with environmental modifications, exercises. There's so much that we can do just to enhance their quality of life as they age, regardless of what stage they're at.
Thank you so much, Dr. Sarah. This has been so interesting, and I'm really excited to get it out there to other senior dog parents because it's definitely not talked about enough, and I don't think they're aware enough of this area.
Mm-hmm.
Instead, because it's all about the drugs and the drugs, which are important and they need,
Yep.
but there are so many other things we could be doing to help our senior dog parents. So thank you very much for sharing that with everyone out there. It'll be really helpful. And
Thank
I
you for
will put
having
a
me.
link to your website in the description so people will know how to get in touch with you. Do you do any like online consultations at all, or is it only in person?
So we're starting to offer. So we started to do a couple of things. I mean, we do have resources on our websites,
Yes.
just in terms of pain scoring, body condition scoring. So pet parents, can access our website, and there's a whole bunch of stuff in our blogs, educational things. We do have a senior dog course that's available online and that's mostly geared for people that, if they can't come to see us. I mean, a lot of the information that we would talk about in an initial
Okay.
consultation is in there. We're starting to offer virtual consultations,
Oh,
for
good.
people who can't come all the way in to see us. There are obviously some limitations with that, because if
Hmm.
we can't put our hands on the dog, then it's harder to do the physical evaluation. But we sort of rely on the vet's assessment of what they've already seen or what they've
Right.
already been diagnosed with. So there's a lot of things that people can get in touch with us about. And if they just want to give us a call, then we can try and find sort of, the best area to be able to help them.
Oh, good. That's fantastic. Thank you so much. And thank you all for watching. And I will see you in the next video. Have a wonderful day, everybody.